السلام عليكم ورحمة الله. النهاردة محاضرتنا إن شاء الله عن blood vessels of the upper and lower limbs. ده part 1 بيشمل blood vessels of the lower limb. في خلال المحاضرة هنتعرف على main arteries of the lower limb, origin, termination, course and branches of each artery. هنتعرف على veins of the lower limb سواء superficial or deep veins, beginning, course, tributaries and termination of each vein. Now we'll start with the femoral artery. Its direct continuation of the external iliac artery enters the thigh by passing behind the mid-inguinal point. This is the inguinal ligament. The artery enters the thigh behind the mid-inguinal point, lateral to the femoral vein. It terminates in the opening of adductor magnus muscle called the adductor hiatus to continue in the popliteal fossa as popliteal artery. Now we'll discuss the branches of the femoral artery. They can be divided into superficial branches and deep branches. Superficial branches of the femoral artery includes superficial epigastric artery, superficial circumflex iliac artery, and superficial external pudendal artery. While the deep branches include deep external pudendal artery, which corresponds to the superficial external pudendal in the superficial branches, profunda femoris artery, which is the largest branch of the femoral artery, will be discussed later, and descending genicular artery. Genicular meaning directed toward the knee joint. Profunda femoris artery is the largest branch of the femoral artery and is considered the main source of blood supply to the thigh. It arises from the posterolateral aspect of the femoral artery and terminates as a fourth perforator. Profunda femoris gives rise to 4 perforating arteries. Profunda itself continues as a fourth perforator. They are called perforators because they perforate adductor magnus muscle. Profunda femoris artery gives the following branches: lateral circumflex femoral artery, medial circumflex femoral artery, and 4 perforating arteries, where the profunda itself continues as the fourth perforator. The popliteal artery is a direct continuation of the femoral artery at the opening of adductor magnus called the adductor hiatus. It runs downward and laterally deeply in the popliteal fossa, which is a rhomboidal space on the back of the knee joint. It begins from the upper medial boundary of the popliteal fossa and ends at the inferior angle of the fossa. Terminates by dividing into anterior and posterior tibial arteries. Along its course, it gives the following branches: superior muscular branches, genicular branches, which are superior medial genicular, superior lateral genicular, middle genicular, inferior lateral genicular, and inferior medial genicular. Also, it gives rise to sural branches, and finally 2 terminal branches, anterior and posterior tibial arteries. The anterior tibial artery is the smaller of the 2 terminal divisions of the popliteal artery. It enters the anterior compartment of the leg by piercing the interosseous membrane, which connects tibia and fibula, and along its course can be divided into 3 parts. In the upper third of the leg, the artery lies on the interosseous membrane. In the middle third of the leg, the artery lies on the tibia, and in the lower third of the leg, the artery lies in front of the ankle joint. It terminates in front of the ankle joint to continue on the dorsum of the foot as dorsalis pedis artery. Now we'll discuss the branches of the anterior tibial artery, which includes anterior and posterior tibial recurrent arteries, anterior lateral malleolar branch, anterior medial malleolar branch, muscular branches, to the anterior muscles of the anterior compartment of the leg, nutrient branch to the tibia. Dorsalis pedis artery begins as a continuation of the anterior tibial artery. It enters the foot by passing superficially on the dorsum of the foot in front of the ankle joint, and finally terminate by reaching the sole of the foot and joining the end of the plantar arch. In about 15% of population, dorsalis pedis artery may be absent, and in these cases it is replaced by the perforating branch of peroneal artery. Dorsalis pedis artery gives the following branches: lateral tarsal branch, medial tarsal branch, arcuate artery, first dorsal metatarsal artery, and first plantar metatarsal artery. Posterior tibial artery, it is the larger of the two terminal branches of the popliteal artery. It descends between tibia and fibula, and in the lower part of the leg, it lies on the back of the capsule of the ankle joint and the lower end of the back of tibia. Along its course, it gives the following branches: circumflex fibular artery around the neck of fibula, nutrient artery to the tibia, which is the largest nutrient artery in the body, muscular branches to the muscles of the posterior compartment of the leg, communicating branch with the peroneal artery, medial malleolar branch, peroneal artery, and finally two terminal branches, medial and lateral plantar arteries. The peroneal artery is the largest branch of the posterior tibial artery. It passes downward and laterally to descend along the posterior aspect of fibula and finally end behind the lateral malleolus by giving terminal calcanean branches. The peroneal artery gives the following branches: nutrient artery to fibula, muscular branches, communicating branch joins its fellow from the posterior tibial artery, perforating branch, and finally terminal calcanean branches. Now we will compare between lateral and medial plantar arteries, the terminal branches of the posterior tibial artery. Lateral plantar artery is the larger of the two terminal branches of the posterior tibial artery. It runs downward, forward, and obliquely along the foot. Then it curves medially between the third and fourth layers of the sole to form the plantar arch. It ends by joining the termination of dorsalis pedis artery. While the medial plantar artery is the smaller of the two terminal branches of the posterior tibial artery, it runs forward and continues in the medial side of the foot. Then it ends by anastomosis with the digital branch of the first plantar metatarsal artery. Now we'll talk about the branches of lateral and medial plantar arteries. The lateral plantar artery will form the plantar arch. It gives plantar metatarsal arteries, proximal perforating arteries, communicating branch with the dorsalis pedis artery to complete the plantar arch, plantar digital artery to the little toe, and calcanean branch, while the medial plantar artery gives three digital branches. Now we'll talk about veins of the lower limb, or venous drainage of the lower limb. It can be divided into superficial veins and deep veins. Superficial veins include dorsal venous arch, small saphenous, and great saphenous veins, while the deep veins include popliteal vein and femoral vein. Starting with the superficial veins of the lower limb, we start with the dorsal venous arch. It lies on the dorsum of the foot opposite the heads of the metatarsal bones. It receives the venous blood from the dorsal metatarsal veins, which is formed by the union of the dorsal digital veins. Its lateral end gives the short saphenous vein, while its medial end will give rise to the great saphenous vein. The small or short saphenous vein begins from the lateral end of the dorsal venous arch of the foot. It runs backward behind the lateral malleolus, then ascends on the back of the leg, accompanied by the sural artery, about 1 inch below the knee joint. It ends in the popliteal vein. Great saphenous vein. It begins from the medial end of the dorsal venous arch of the foot. It ascends on the medial side of the dorsum of the foot and passes in front of the medial malleus. Then it ascends obliquely on the medial side of tibia to reach the back of the knee joint, and finally ascends upward and laterally to terminate in the femoral vein. Along its course, the vein contains many valves and receive the following tributaries: medial marginal vein, perforating veins, communicating vein connect it with the small saphenous vein, anterior femoral cutaneous vein, posterior femoral cutaneous vein, deep external pudendal vein, and the 3 superficial veins: superficial external pudendal, superficial epigastric, superficial circumflex iliac veins. Now we'll talk about the deep veins of the lower limb, which includes popliteal vein and femoral vein. The popliteal vein begins by the union of the vena comitans of the anterior and posterior tibial arteries and terminates at the adductor hiatus to continue as the femoral vein. It receives the small saphenous vein and 5 genicular veins which corresponds to the arteries. While the femoral vein begins at the opening of the adductor magnus, which is called the adductor hiatus, as a continuation of popliteal vein, and ends behind the inguinal ligaments to continue as external iliac vein. The femoral vein receives great saphenous vein, profunda femoris vein, medial and lateral circumflex femoral veins.